966.
We're speaking now with Dr. Fatimah Alhamlan from the King Faisal Specialist Hospital and Research Center, which was recently named as one of the top hospitals in the world by Newsweek. Dr. Alhamlan is adjunct clinical scientist, Department of Pathology, a graduate of Washington State University, University of Idaho, and also studied at Harvard Medical School and Harvard Business School. Thank you so much for joining us today on the 966.
Thank you for having me.
Fatima, what a treat. Thank you for coming to be with us. We were just discussing it. We came to you actually through our friend Bill Connor, who was with his Oratorio Media, and he was working with, he is still working, I believe, with the Ministry of Media and this skilled speaker program, which you were part of. How did you get selected for that?
Well, I was selected because I'm kind of active in the community and in the social media. I do have, during COVID, I was the first line responder and or front line responder, basically. So we were very active in the community. Our mission really was to help the community to face the pandemic. Our mission as a scientist is to communicate science to the public. We got through several obstacles during the pandemic, if you remember. Everything was new, and this is the first time the whole society faced with this pandemic. It was a lockdown. No one knows what's happening during that time. So as a scientist, we stepped in and we tried to help and communicate the science and knowledge to the community. And again, I do have an organization that's very active in the community. Again, our mission is just to help others and to educate others. And that's how I got actually selected in the program.
Well, we're going to get to all that. And I want to, let's start not quite at the beginning, but let's talk about your academic path. And a lot of it was in the States. It started back in the early, 2004, 2005, very early on the front end of the then King Abdullah Scholarship program. But it's a very curious one. And when we were talking about it, can you share with us where you started and then where you ended up?
Well, I have a fun and twist journey when it comes to my academic path. Actually, I was not I didn't join King Abdullah Program Scholarship. I started before that. Right. And I was not the scholarship recipient. I was dependent. So my husband was a scholarship recipient. He was actually supported by his job, by employer, even it was not King Abdullah Scholarship Program. So going back, looking at the journey, basically, so I was living in Medina, which is the second holy city in Saudi. I don't know if you have been there.
Oh no, I don't think we're allowed. But we have not. Okay. We have not been there. Yeah.
Yeah.
We'd love to go. If they make an exception for us, we'd love to go.
Yeah, that was. So I started my bachelor's degree during 1999, and after that I was in Medina studying. Then I got engaged to Abdullah, who's my husband now. During that time, he got the scholarship from King Faisal Specialist Hospital. He was an employee there. So he got the scholarship. Then we were talking about moving to the States. So I told him I need to finish up my bachelor's degree first, then I can move with him. So he left to the States. Unfortunately, September 11th happened at that time, 2001. So I joined him basically after I graduated. It was like 2002, 2003. Again, I was dependent. I was not the scholarship recipient. Studying in the US, the immigration status, it's not easy. As my visa was F2, I'm not allowed to study full time, and also I'm not allowed to work. So that was kind of the challenges I started to face when I got there. I had two options, either to go back to Saudi and apply as a F1 student, which was impossible because I don't have a scholarship. There was no scholarship at that time, if you remember. The other option was to stay in the States and apply to convert my visa to F2, which is going to take at least 6 months. I have no option, so I just to accept that option, so which is the second one. I started the paperwork, converting my visa to F1 so I can study. The Saudi Commission, the Saudi Cultural Mission in Washington, actually they support the dependents with English as a second language, part-time. Yeah, so during that time, they supported actually my studies. I joined it was Washington State University. So I joined the English and I started that journey slowly. It was part-time. Then my husband called one of his professors to accept me in her lab to volunteer. It was Dr. Nancy Magnuson, amazing individual. She's immunologist working on cancer. So I joined her lab as volunteer, and actually it was the best experience ever because this is the first time you are exposed to real research, to real labs, to different studying environments than what I used to. It was an eye-opening experience. I got to know what research is, what they are doing. There is no a major called microbiology or virology. They were very specific, and every professor would pick a gene or pick something in a pathway just to understand. You see the lab, it's like a beehive. Everyone is working on a project. You see the university, you see the campus. And if you know Pullman, Washington, the only thing in Washington State is the university. Basically, it's just the university. So it's a small town, international students. The vibe is amazing. It's just inviting, you have to do something. You have to study. So it was great environment for me actually to persist and to decide I would do it. It was not easy journey at all because getting the admission was not easy. Getting a scholarship was not easy. It took me really over a year and a half to get the master degree, to get the master admission. So I started to work. I started to get non-degree program just to be eligible to join the master degree. So luckily I got the scholarship. I got the admission and I got pregnant with my first daughter. All good things happened at once, all at once. So it was worth the wait. So again, I started my master degree in Washington State University. I zipped through it. It took me like 1 year and a half. For a woman coming from Saudi, having this opportunity, it was a life-transforming experience. It was great advantage I had. I was so thankful. I am still so thankful for the whole things that have happened during that time. It was not easy, but it's worth it. And during that trip, during that journey, all in my mind is just to continue pursuing my graduate studies. I'm not coming back till I have it all done. Despite all the obstacles, the hardship we've been through, I just decided I will continue. So I zipped through my master's degree. Before I defended my master, I applied for PhD because I was not planning to come back because that's my chance that I will finish it. So I didn't defend my master's degree. I got admission for PhD and I got my scholarship upgraded. And that all happened at the same time. Then I got my scholarship actually upgraded, which is very big help to have the government support. The government support means the support for the whole family, including the kids. So that's where I got my PhD admission in triple major, actually. I got it in microbiology, molecular biology, and biochemistry in University of Idaho. And again, it's like 7 miles away. So I stayed in Pullman, Washington. I was just commuting every day. So again, the same scenario happened. I got my PhD admission, I got the scholarship upgraded, and I got pregnant with my second child. So that's another journey of PhD. When I started my PhD, remember my husband was doing his PhD and he had to leave because he graduated. And the moment of truth came, he has to come back to report to his work. For me, I told him I'm not coming back. I just got this admission, and I have the scholarship. I have everything I need. This is the great opportunity. I will not give it up. So I'm staying. You cannot do this. 2 kids, you are alone. PhD studies is not easy. And that was like, I will do it. And again, I continue. He actually very, very supportive. He applied for a postdoc position in Washington, so he can stay with me 2 more years. And that, again, was very helpful. But again, after 2 years, he had to report back to his work. And I had to, yes.
Oh, it's this scholarship program is just amazing. All the way from that did include dependents, and as you said, you weren't in it first, and you had to apply. But just to hear you are, a Saudi doctor who's studying in the States and is really excited about Pullman, Washington. You
Absolutely.
love, and you don't have that experience unless it's you get the opportunity to have that experience. And so many young Saudis, that came to the States underneath the scholarship or opted into the scholarship or accepted into the scholarship, like you were, just had life-changing experiences. And like you say, your whole exposure to how research is done and obviously getting your degrees and I think probably very positive perceptions of the United States is invaluable. It's just something that you can't. I liken it a little bit in the U.S. to the GI Bill. After World War II in the U.S., it enabled many, many, many soldiers to go to college, and it transformed. Economically, it was a tremendous boon to the U.S. economy because you had all these educated, skilled people that were now available for the economy. And so many of you young Saudis that were part of this scholarship program are now back doing exactly what you're doing back in Saudi Arabia. So let's finish this journey. You've done now after you were out west, Idaho and Washington, but you also came back to Boston, right?
Right.
To do you have some further education at Harvard Medical School.
That's right. So basically, after finishing my PhD, I went back to Saudi and I got a job in King Faisal Specialist Hospital. And again, I got a scholarship to join Harvard Medical School. It was a global program. It was focusing on clinical trials, epidemiology, and biostatistics, basically. So that's where I started my HPV, which is the Human Papilloma Virus Project and cervical cancer. I joined Harvard Business School. I worked on my capstone project. And again, after completing this program, I got actually the status to be alumna of Harvard Medical School. My project, the capstone project, actually was commended, and I got, even later than that, I got a CACS, which is a funding agency in Saudi. They funded my project with $2 million. So that, again, helped me to start my research line in Saudi when you are talking about women's health and when you're talking about human papillomavirus and cervical cancer. So that's where I moved to Boston. We finished up this program. And this is the relation started basically between both laboratories and the work we have been doing on human papillomavirus and cervical cancer.
So let's bring you back to Saudi. And did you come back directly to a position with King Faisal Specialist Hospital?
That's right. So I came actually and I applied for a job. It was not easy. It took me 7 months to get the job. So this what happened during that time. But again, I joined immediately as volunteer because, yes.
And as Lucian said, I mean, King Faisal, that's the leading hospital in the country, and it's globally, it's a well-respected. I can speak to that, to be honest. I have personal experience with King Faisal. When I lived for a time in Saudi Arabia, and my sister was in a very bad car accident in California. She ended up having a lot of her treatment at King Faisal. And they did wonderful work. This was way back. So they've been a remarkable institution for some time.
They are. And King Faisal, again, if you look at the name, the research center is attached to it. And I think it's the only hospital in Saudi or somewhere. It has the research center attached to it because they believe in medical research. And that's where I belong. I love research, and King Faisal is the best. And if you look at King Faisal, it's advanced, and it has its own culture. Even when I came back from the States, my friends in the States, they told me, how did you adjust? Was it easy? Was it hard? It's like in the States, you have this mixed culture, and now you will go to segregated culture. And I told them, no, this is not true. In King Faisal, it's like you are somewhere in the US. It's the same setup, the same labs, the same conference rooms, male and female working together, different nationalities. It's just the best professional workplace you could be. So I'm so glad I joined King Faisal, and still I'm with King Faisal.
So you love research. You love to do that. You love research, but you also have an interest in NGOs and women's health issues, and so that it's not specifically research, but you're founder and vice president of Rofaida Women's Health Organization. Where did all this begin, and how is it? How do you spend your time between all these interests?
It's all actually connected. If you look at research, what is the purpose of research? Is to improve, at least for the medical research, is to improve people's lives and health. And again, I was doing my research on human papillomavirus and cervical cancer. As a researcher and observer, you always ask why we have this problem, and you want to understand where is the root cause of that problem. So this is where we started to look into the problems that we are facing and the research we are doing. If you look at human papillomavirus and cervical cancer, it's basically cervical cancer is the easiest cancer to treat. And when I was in the States, I never thought about it as a problem because there are vaccines and there is a cervical screening test, which is the pap smear. It's part of any regular clinic. It's well known, it's well established, nothing new, and you would think everyone is doing it. When I came back, it's not the case. It was the case for King Faisal. But it's not the case in other hospitals. And you end up seeing women coming with cervical cancer in late stages. And this is heartbreaking to see someone dying of something that you can't prevent easily. And again, you feel there is a gap in the community, and there is a dire need really to educate women in the community. So the whole idea of Rofaida started. You live in a community where you always listen to the community and their needs. In the beginning, we were doing some awareness campaigns here in King Faisal and some areas, but the impact is very limited because you are going to do it in a lobby. It's just a regular pamphlets and infographics, and it's just the impact was really limited. We got together and we worked about the opportunity of starting an NGO, not an NGO for cervical cancer per se, because we don't want even to mention diseases. We want the health of women. We want to tackle women's health issues in general, because looking at women's health in Saudi and other parts of the world, still there are so many things that can be done to improve women's health. And we always believe that improving women's health, improving the family's health, improving the community. Because if the female in the house is educated, the whole family will be educated. And this is really our mission, is just to give the female the accurate, reliable information, evidence-based. And that's where it's connected to research. So whatever we are doing research, We communicate it to the community. Our mission really to give the women the accurate information, then it's her decision.
I agreed. I mean, the impact of women in the household and the community, and the more educated they are, the better. I'm really fascinated because when we talked with Mohammed Al-Haji, who you mentioned you met through the Skilled Speaker Program, he started the Saudi Genome Project, and the motivation there was to help initially back in his home community in Al Asa with intermarriage, and to identify potential problems with this. I'm just really impressed, to be honest, with the motivation of people like yourself to come back and make a difference, to not just get a degree and come back and get a job, but to actually engage with and try to improve the community. It's very admirable.
Yeah, absolutely. Again, the scholarship programs, it's not about degrees. When you live abroad, you see the world with different lenses. You see the whole ecosystem. You see how others are living and the importance of social responsibility. We belong to a community, and some people, they are privileged to have things others they don't have. And it's just not fair to just focus on yourself and get the degrees, get good salaries, get a good house and good life, while others are struggling. You have to be an advocate. You have to be the voice for others. And for me, I have been advocate for women, always been the advocate for women. Whatever I get, I wish everyone else would have it. It's just, I'm so lucky to have a supportive family. Remember, during the old days, if you don't have a supportive family, that's it. That's the end for you. For me, I have a very supportive family. And throughout my journey, it's because I have a supportive family, and I'm privileged to have all of this. Now it's my job to help others and to be the voice of others. And I think this is our mission. And we shouldn't be selfish, just thinking about ourselves and our needs. We are part of the community. And this is how the community thrives, is by helping each other. And really, if you look at the advocates, either for women's health or for women in general, you would see them. They have everything, okay, but still they are advocating for others. And I think this is the nobility here. This is when you think bigger than yourself and you want to help others. And again, everyone will benefit.
Wonderfully put. And as I said, very admirable. So in 2018, you headed back to the United States because you were awarded the Eisenhower Fellowship. What is the Eisenhower Fellowship, and how do you win that fellowship? It looks like it's very impressive.
Eisenhower Fellowship, it was again a transformative experience for me. I lived in the States for 9-10 years, and with Eisenhower Fellowship, I looked at the States from different lenses now. It's completely different journey. So the fellowship, basically, we applied for it and we got the award. We were a cohort of students, different majors, different disciplines. We got to work together. It's a leadership program where you want to make an impact. Most of us, we have projects. For me, it was the Women's Health Project and bringing women's health research to forefront in Saudi Arabia. I have my colleagues, they had projects in oil, in hospitality, in business, in biotech parks, in philanthropy. So we were grouped. Now, you don't focus only on your work, how to work with the group with different interests to make a huge impact or a bigger impact. We visited different states. For me, because I was focused on the health, I visited the top health hospitals, research institutes, NGOs in the US. I visited Mayo Clinic, Johns Hopkins, the NIH, Boston, all Mass General, everything. Yeah, it was, I visited like 17 states. I visited NGOs because, I'm always interested. So the science and healthcare system, it's easy to get the information, but sometimes for the NGOs, for example, how they sustain the NGO, how they generate funds, how they do the fundraising. it's always interesting me. And also how they communicate the information to the community. So I visited HIV organizations and sexual transmitted infection organizations, and I asked them, how do you do the education with these sensitive issues? So I got to know more about even the community and even the resistance in the community when it comes to these sensitive issues. So at the end, when you think about it, we all have the same challenges, and we all have the same important topics that we tackle. Different priorities, different challenges, but really every community, every country, every society, they have their own problems, and they are still working on it. We don't have a perfect society. With Eisenhower Fellowship, I saw the good and bad. I saw the healthcare system. I saw the challenges that are facing. I will take you back to the women's health research per se. So what I mean by women's health research? Women's health research is when you include women or include females, let me put it that way. You include females whenever you are doing research, because men and women are different. You cannot do research on women, on men, and come up with a conclusion that fits everyone, okay? And when you are talking about women's health, you are not talking about gynecological health. You are talking about everything. I'm not sure if you have heard the story about that ignites the whole thing when it comes to women's health. There were a woman, she came to the ER. She was nauseous and she was not feeling well. And they told her, no, you must be stressed out, just go and relax. And she ended up having a heart attack. And it turned out to be the women's symptoms different than the men's symptoms coming with a heart attack. So she was discharged from the hospital. And since then, the movement started about women's health research. I visited the Office of Women's Health Research during my Eisenhower Fellowship. That was in Maryland. And remember, the Women's Health Office, it was established 1990, like long time ago. Only in 2016, they regulated the women's health research by, they are not going to grant or fund any project if there is no inclusion, if there is no male and female part of this research. And this is a huge movement. But for me, it was recent. It was not, I would expect it long time ago, but it happened in 2016. When I say male and female, that includes everything. That includes cell lines in the lab, that includes animals, that includes human in clinical trials. So when I came back from the Eisenhower Fellowship, three things were the main thing that I'm advocating for scientists, researchers, clinicians. Whatever you do, you have to include male and female in your research. That inclusion is very important. And also for the regulators, the grant funding agency, you have to require this in order for us to have a valuable research output and outcome. And also for women to be part of a research. Women, they don't participate in research, and it's a struggle. And it's a struggle everywhere. I know it's a struggle in the US. It's more struggle in Saudi. And personally, I have struggled so many times to get a cervical swab for a female. When you ask them to consent, you tell them, well, they are going to take the swab from you. And instead of throwing it, I will take it to do more research on it. She would say, no, I would rather them throwing it, not giving it to you to research, because they were afraid. They don't understand what research is. I always put it in a simple way. It's whatever we are enjoying right now in the healthcare system, it's based on research. They didn't come up with a protocol or a management without research. Research is the core of everything that we are getting. And maybe I'm focusing on medical research, but really everything around you. If you think about women in the industry, for example, it's important when you test the seatbelt to test it on females as well, because the body different. So the inclusion is very important, and we have to understand this. Whatever you are doing in life, inclusion is very important. You don't pass the quality check without trying it on everyone. For so many years, they just use the mail and they just report the results, and that reflected on strategy, management, everything. So that's the call out we learned, and again. Eisenhower Fellowship, I can talk about it forever. It's an amazing experience. And the staff, the Eisenhower staff were amazing. And really, I'm very thankful for that experience. It was really a game changer. And again, you start to look at things differently. Now you want to make an impact. You want to do things right. And instead of just doing it the way you would think, there is always a better way to do it, and having a good network, because we kept the network with our colleagues in the States, and this is how you improve and do things in the right way.
It is interesting that in the U.S. the mandate didn't occur until 2016. So, as you say, you have struggled with awareness and understanding of these issues. Is it getting better?
It is much better. But again, as I said, I'm a big believer in education and awareness and knowledge. Knowledge is power, and our job is to share that knowledge. Either they reject it or take it, it's up to them. Sometimes, from my own experience with the HPV, they reject in the beginning, but later on it will resonate. Later on they will go back because they will hear about cases happening in the community, and even sometimes there is a negative publicity. They will get mad. They will just they don't like such a topic, but later on they will realize. And with the sensitive topics like these, people privately asking about it, not publicly. So we do have a channel in Rofaida, a women's health organization, to get their questions and answer them. For me, it's not important to bring it publicly, bluntly. I don't mind, but if the message will not get across, I would do it other channels. The most important thing is just to put the accurate information out there. It will reach out. And also, it's very important to articulate the message. Our job as a scientist is to spend time really how to communicate with the community. Don't expect them to be all at the same level. Don't expect them to understand the details of this. It's not easy topic, but the good thing is we got the support from the healthcare, from individuals, from clinicians, from scientists. So you have this community who is working together to educate others. It's a sensitive issue, yes, but I think now we are understanding. And I will tell you something. In 2016, we had a Women's Health Advocacy Forum. This is done through Rofaida in collaboration with King Faisal Specialist Hospital, where we bring a women's health rights and asks that we bring it on the table with the policymakers, and we need their help and support. In 2016, Dr. Abdullah Asiri, who is the Deputy Minister of Health for Preventive Health, the ask was, we need to mandate, or we need to start HPV vaccination in Saudi. That was 2016. He gave a lecture on that topic, how important it is, because we are in the era of preventive medicine, and Saudi part of the international coalition to eradicate cervical cancer. We are the luckiest country that we don't have so many cases, so it would be easy for us to eradicate. Why we don't join efforts and we start? That was 2016. We are going to have the same advocacy forum next month, May 25th. Dr. Abdullah Asiri is going to be the keynote speaker to announce the launching of the national program of HPV vaccination for school girls. Can you believe this?
Congratulations.
Yeah, that's awesome.
That's congratulations, Mabruk. That's really impressive.
That's impressive. That's amazing. That's what advocacy means. It's just everyone getting together to advance this agenda and to help and save women. We don't want to talk about these things anymore. It's just a prevention. There is a vaccine that prevents cancer. Why don't you go and get it?
Right. So, all right. So you're full time at King Faisal Specialist Hospital. You had this Rofaida Women's Health Organization, which clearly, as you see, has had some great success and is doing some wonderful work. Somewhere in there, you were chair of the Global Health Working Group for the C20. Now, we're big fans of that whole process. The first episode we did on the 966 was Abdullah Hassan, who was a sous Sherpa for the G20 and head of policy, executive director for policy of the Saudi General Secretariat. And it was an extraordinary experience, I think, for him, an extraordinary experience for a lot of Saudis. So what were your responsibilities as chair of the Global Health Working Group for the C20?
Again, that was a great experience. During that one, actually, I was wearing two hats, as a virologist, because it happens really during the pandemic. Right. And I was working full time during that time. It was a lockdown. So I was really working full time during that time. And also I was wearing the hat of the civil society organization. So the working group basically is to bring to the G20 leaders the important topics that voiced by the civil society worldwide. So we had over 600 civil society organizations join the C20, which is the civil 20. And basically, we bring up the issues that needs to be discussed by the G20 leaders. Three important issues during the pandemic was the focus of the C20 group. It's basically the equity, and it's still until today the equity, everything that's taking place right now, we are not happy with. In the beginning, it was during the pandemic with the preparedness, with the testing facility. Not every country has this capability and has the facility. So we were asking for the equity. Also with vaccination, until today, Richard, we are still seeing the problem with the variants because the vaccinations were taken by the rich countries, while other countries, they don't have the privilege of having these vaccinations. And remember, as a virologist, infectious disease does not respect borders. You cannot make your country safe if Ghana is not safe or if other country is not safe. Infectious disease will reach you. So we have to think on a global level. And that was actually our ask in the civil society C20. It's basically the equity, it's basically the universal healthcare system. Healthcare insurance, it's a human right. Everyone should have an access to the healthcare. So that was our ask. And the third one is the investment in research and development. When the pandemic started, when COVID hit, the whole world was looking for scientists. What are they? Where is the vaccine? Where is the detection assay? Everyone was looking for scientists. And really, you need to invest in infrastructure of science and technology, because this is what saved us. The vaccine that we're lucky to have, it didn't happen in a month or two. Research was done since SARS 2003, isn't it? Like the messenger RNA vaccine. It's during the China SARS infection. During that time, they were working on it long time ago. Then till they had the platform ready, they have the technology. So when Corona hit, they got the fund and immediately they gave us the vaccine. It's a real investment. It's a huge investment. It's a long-term investment. And this is the call, is just to focus on research and technology. I want to take you back within Saudi itself. When you are talking about the civil society organizations, during the G20 presidency, the civil society organizations were very empowered during that time. So for the C20 was led by King Khalid Foundation, which is leading philanthropy in the country. The Women 20 was led by An-Nahda, which is another old NGO in Saudi. And the Labor, the L20, was led by another NGO. So 3 NGOs, they were running 3 different groups. And that was impressive to see it happening in Saudi, because now the trend is empowering the MPOs in Saudi. For a long time, they were not empowered. Now, if you see the changes happening in the community in Saudi with the Saudi vision, government, private, MPOs, they are all working together. It used to be the government doing everything. Now, no, you have to activate the MPOs. The MPOs now, it's not a charity as used to be. We are not giving away money. We are developing programs. We are empowering women. We are giving them the tools. This is new in Saudi, and luckily, in Rofaida Women's Health Organization, our chair is Princess Modi bint Khalid, who is a prominent philanthropist. She has over 40 years of experience. She has been through so many roles in the NGOs. She established so many. And also, we were incubated by King Khalid Foundation. King Khalid Foundation, they have also a long history when it comes to NGOs. So we established Rofaida. It's a new startup, but really with a good expertise, with a good experience from the founders, and with the help with King Khalid Foundation, we run the NGO as a business where you generate revenue, and at the end, the profit will come back to the operation to expand. Now you have a sustainable plan where you have an endowment, you have an investment arm. So the whole business, it's really as a business model. It's not a charity. It's not just collecting money and giving it back. No, even the programs we designed, we give the women the ability and the empowerment to survive in her own. There is no money involved here. We develop everything, and that's the whole idea. Remember the Chinese proverb, like, give a man a fish, you will feed him for a day. But if you teach him how to fish, they will survive long enough. So that's basically what we are doing. This is the change in the MPO system in Saudi. It's basically empowerment. We are not just giving away money or food. And this is a great transformation happening in Saudi. And I'm glad this is happening.
Is the proper term social entrepreneurship?
There is, yeah. So this is exactly what we are talking about. But some there, So again, you have to have an impact. And again, social entrepreneurship is the perfect example. We are not taking it to that level yet. But I think at the end, it will all turn to be that way. Because again, the government not going to support everyone. Basically, you have to stand alone, independent. And it's always good. I'm sure you are aware of this. For NPOs, they should be separate from the government. I mean, they can be regulated for governance and other things, but overall, you have to be the voice of people. You have to develop your own program independently. And for us, we are advocates for women's health rights. So this is what's happening now. And to be reliable, you have to be strong and standing alone. Even your income, because at the end of the year, you will show your income. If you take more money from the government, then you are a government. Okay, you are not an NPO. So that's what we are trying to do, is minimize the funds we get from the government, and we have other resources, because you are the voice of people, you are the voice of the community, and that's where you need to generate your income.
That's interesting on the G20, because I guess there's 8 subgroups, and as you're saying, 3 of them were run by NGOs, and the explosion of NGOs and their mainstreaming of NGOs and the habit of NGOs has just been fascinating to watch over the last 5-10 years.
Yeah,
it's really exploded. So How optimistic are you about women's empowerment in Saudi Arabia?
Very, very, very optimistic. Well, when you are talking about women empowerment, it's already happening. If you look at the statistics, if you look at what's happening in Saudi, if you look at our goals for 2030, we already reached it, and actually we passed whatever we are planning. It's now 42%, I think, women in the workforce, which is exceeding our goal. If you look at the last report, the World Bank report that was published 2021, and you can see the ranking of Saudi. If you compare 19 to 20 to 21, we jumped. Now we are, I think we got 80 out of 100 in just a short amount of time. We actually topped the score for 5 indicators. We got 100% for employment, entrepreneurship, salary-wise or pay scale, pension, and so we got like 100%. And this is a huge movement happening in Saudi. If you remember in 2000, actually last year, 2021, the Crown Prince announced the legal reform. And you really cannot do women empowerment if you don't have a legal reform system and the legislative. The Crown Prince announced 4 huge reforms that will take place. And if you remember, the first one was the personal status law and the evidence law and civil transaction, and the last one was penalty code law. Those 4 is very important. 2 of them passed, and the important one is the personal status law. The personal status law is basically focusing on family affairs, and this is very important when you want to empower women. Women empowerment is not at workplace. Women empowerment starts from her house, from her family. If she's not empowered in her house, that's not women empowerment. So this is the reform happened and passed last week. It includes everything you would imagine when it comes to a family affair. It includes the marriage, it includes the divorce, the custody, the housing, most importantly, the minimum age of marriage. It's 18 now, it's set. So this is a huge reform when it comes to women's empowerment. And again, things are moving, things are changing positively. We are seeing women, I'm sure you are aware of all things happening in Saudi. Women are advancing in leadership positions, the vibes in the community, the youth, and really, every time you meet someone, you mentioned Muhammad Al-Haji, he has another project. It's like even one project is not enough for everyone. You would find people having more than one project because the potential is really high. And there are so many opportunities that you can give back and you can empower the community. Sorry, I need to minimize this. So I just want to mention something. Being a catalyst or being someone orchestrating so many things, believe me, if you have a good team, if you have a good community, it's not a lot of work because everyone believes in your cause. And for me, sometimes they would tell me like, how can you manage all of this? Well, I'm not managing everything. So we have teams. When you are talking about Rofaida, per se, Rofaida has 25 founders, amazing individuals. We have the board. Everyone has a responsibility and everyone owns it. If you meet anyone, you would think this is the only project he has in life, how passionate they are and how they believe in this mission. And this is really the empowerment we want to see in the community. Everyone wants to give his time, his knowledge, his money, just to empower everything and uplift the society. And this is the momentum that's happening in Saudi is amazing. And I hope it will continue this way.
Well, you mentioned a catalyst, and clearly you are a catalyst. And yes, you're right. I mean, it's not Rofaida sounds extraordinarily impressive, and you say 25 founders, but you're the founder, and you know, and clearly people wanted to gather and support you and do this work that you think is so important. And it's just really impressive. And on the personal status law, agreed. We've done a segment on it. It's a landmark thing for Saudi Arabia. And for so many years, we talk with, friends of ours who are Saudi women, and they say, driving is nice, but as you say, we need to make adjustments in the household. And that's what this personal status law does.
You mentioned, so women's empowerment is women's health. It's legal reform. It's economic opportunity. It's also communication, which you've talked about here. And I'm just a little curious about, communicating in the modern age now in 2022 is difficult. It's social media, it's digital, everybody's connected to each other. Are there unique challenges for you in Saudi Arabia to connecting to the masses? Saudi Arabia is a very connected society. How do you get your message out there as widely as possible? Because you've mentioned sort of interpersonal conversations with women. And we saw in Saudi Arabia with the coronavirus sort of a mass awareness and information campaign to get the vaccine. Are you guys going to adopt similar strategies? If you could talk a little bit about that, I think that would be interesting.
Yeah, sure. So about the communication is very important. And for Rofaida, when we are designing programs, actually, if you look at our programs, we have one of our programs is called Unfiltered Talk, where it's a monthly session where we open up a topic about gynecological or sexual health. We bring the experts and we do it through Zoom. We do it through Instagram. So anonymously, you can write your question. You can get the information you want, because at the end, we just want to pass the accurate information. I don't need to know who you are. So we are making this a possibility also. We are doing some on-ground training. We are doing some private training. But at the same time, we are utilizing all social media platforms. So this is very important. And also, we are trying to articulate the message right. And there is a huge need for accurate information in Arabic. And that was one of the reasons why we created Rofaida. Mm-hmm. Reading English and knowing English is a privilege. You can look up any resources and get the information you want. However, it's less information presented in Arabic. There is no much medical information, reliable medical information in Arabic. So that's why our job, even to translate or to provide the accurate information, make it available for females, instead of just reading a WhatsApp message or nonsense messages that it's just not reliable. So our job actually is to bring the messages in Arabic for our own population and our community. This being the case, actually, when it comes to women's health. Again, women's health, COVID vaccine, HPV vaccine happening up now. We are facing the anti-vaxxers group as well as you guys. I know in the US, you are struggling with those. We have them in Saudi. And again, I always believe if you give the accurate information, people, they need to make their minds and they need to choose the right things. You cannot force everyone, but you have to be active and you have to give them the information. Don't be passive and say, I don't care. No, as much as they put wrong information, put the accurate information. Don't confront everyone. Just make the information available and be available to defend and be available to present. If a message coming out of King Faisal Hospital, it's a reliable. If a message coming from MOH, it's a reliable. The government will not kill you. The government will not provide anything harmful to you. Our job is to help the community. Our job is the public health. So being available, being presentable, being passionate and compassionate about this. People are different. People sometimes they don't know. They are afraid. Just being available, I think, with the accurate information is very important.
That's a really go ahead.
No, please.
No, that's a really good distinction about Arabic, making it available in Arabic. And I have to say, I don't know what your response was, but somehow it was encouraging to me that you're dealing with anti-vaxxers too. I don't know why. I go, oh, really? It's not just us. That's good.
It would be great if only the U.S. had the problem, but at least we're not alone.
Exactly.
Unfortunately, but again, science prevails. And another thing I want to mention to you regarding the importance of working together in a society. I think civil society organizations, they are more acceptable when it comes to these movements, these vaccines. People, they listen to the civil society organization rather than the government, for example, because, everything was politicized at some point. The mistrust sometimes is there. It's like you are just, it's a commercial, it's pharmaceutical companies, they want to sell something. And when a civil society organization takes the awareness campaigns, and I think it's worth it, and it's reliable, and people, they love to listen from civil society organizations because, again, it's just you are the voice of community, you are giving them the truth, and you are trying to protect your society. So
the enormously impressive Dr. Fatimah Alhamlan joins us from Riyadh. This was a really wonderful conversation. Thank you so much for your time. Brava.
Thank you.
Fatima, it was really an honor, and I thank you for joining us. I hope maybe we'll have you back on sometime, because if we can fit into your busy day.
Well, thank you so much. And before I end, I just want to share it with everyone who's listening, to everyone who's listening, wherever they are in their journey. It's just live with a purpose and have an impact. Whatever you do, every one of us can do something to the community. And if we just keep this in mind, every day we wake up, we go to work, if you just incorporate this in our daily life, and again, just to live with a purpose and have an impact, I think the world will be better off.
Inspirational as well as impressive. Thank you, Fatima.
Thank you.